If you are taking block exams, if you're taking step 1, most of step 2, you're very familiar with a certain question type. That question type is called a single patient-centered vignette or single best answer kind of question. You know exactly what I'm talking about. It's where you get a whole bunch of information, and then there's a question, and then there's multiple choice answers. You'll take 10,000 of these question types in your years in medical school. So being able to master an anxiety-resistant approach to those questions and use them every time you approach a multiple choice question of this type from the beginning of medical school is a huge advantage. Welcome to Test Wolf. I'm Dr. Rosie Hunter. I'm a psychologist specializing in anxiety and performance under pressure, and I'm the founder of Test Wolf. Our mission is to help you crush test anxiety and build a more resilient future, one test at a time. If you have anxiety, if you experience test anxiety, you can't just approach those questions casually based on what the subject is, how you feel. Sometimes you read the answer choices first. Sometimes you read the actual question prompt first before all the context. You can't just do it differently every time. You have to approach all of these questions the same way to develop an anxiety-resistant test-taking strategy. When I'm working with students, and sometimes this recommendation is enough to boost your scores, just using this strategy. Read the question prompt first. The thing that says, if Sally's burping all day today, she's got what condition? Read that question prompt first and then go back and read all the context. Look at the charts, look at all the numbers. Do that after you know what it's going to be asking for. That's because your anxiety starts to look at all this information, and depending on who you are, your anxiety could do a couple of different things with it before you know the question. You might start to hone in on what you think is a good answer before you even know the question because of word association, appreciation for the familiarity of certain subject areas. Or you might start to tell yourself, I don't know what this is going to be. I don't know what this is going to be. So read the question prompt first, go back and look at the context and read through the context, read the question prompt again, and then say to yourself, do I know what it's asking and what would be a good answer? For example, you don't have to know specifically what it would be, but you might think to yourself, I know that the correct answer is going to be a virus, not a bacteria. So once you can say that to yourself, only then do you go to the answer choices. There's this thing that happens in anxiety that's hardwired based on our fight or flight response, where our eyes start darting around. And that's because our brains are looking for threat. They start looking around rapidly at threat. And this happens on individual items when you're taking a test too. Your brain is going to start to choose words from the answer choices and make you start to conclude and converge on those words. If you need to put your hand up so that you don't look at the answer choices before you know what it's asking and what a good answer might be, put your hand on the little screen at the Prometric Testing Center and cover up those answer choices until you've done those first few steps. Then go through the answer choices in order. A, is that a virus or not? Cross it out if you're 100% sure it's not the kind of thing you're looking for. If you're not sure, you can leave it uncrossed, don't use the little cross out feature, and go to B. Is B what you're looking for? And cross it out. There is no question that you can't cross out at least one answer. You cannot get certified to sit for step 1 without having been in medical school for a year, without having passed all of those block exams for a year and a half. Remember that multiple choice tests are about looking for wrong answers as much as they are about converging on the right answer. So go through every single answer choice in a disciplined way, even if you think you know the answer, because you've already saved time by reading the question prompt first and not having to read that context multiple times. So go through each one of the question choices. When you narrow it down to 2, think of a reason why one would be better than the other, circle it, and don't flag it. So now why do I say don't flag it? That's counterintuitive, right? A lot of people will flag it if they got stuck on 2 possible answers and then plan to come back at the end of the session. But if you have anxiety, you could end up with 30 or 40% flagged. Make sure that you're flagging things only because you're going to come back and do something differently on that question, not because you got down to 2, you made a reasonable guess. There's nothing else you can do. So this is an example of an anxiety-resistant test-taking strategy that you can use every single patient vignette question. Think about how many times that is through medical school that you approach a question like this. If you start early using this strategy and all through your studying, all through your UWorld, all through all the questions you approach that are of this type, you use the same approach. Anxiety doesn't have room to hijack what you're doing on test day because you've got a game plan. Even if your heart's racing, you know the steps to approach an individual item. It's much better to tell your brain what to do than to tell it what not to do. Don't be anxious.